So you want to know more about surgery for prolapse. You may know that a weak pelvic floor can cause a bulge in the vagina, called a prolapse. Think of the vagina as a house, with front and back walls, and a roof at the top. If the front wall collapses, the house is still livable. If the roof collapses, you may find it impossible to use your house. Your house relies on a strong foundation, the pelvic floor muscles. It also relies on strong support beams, called the pelvic ligaments. Together, the pelvic floor muscles and pelvic ligaments keep the house upright. The uterus, or the top of the vagina after removing the uterus, is like the roof of the house, and it can collapse if its supporting beams or ligaments are weak. While you alone can reinforce your foundation and exercise your pelvic floor to make it stronger, you may need an architect to rebuild your roof. That architect is a pelvic floor surgeon. What they might recommend is called apical prolapse surgery. It typically involves fixing supports around your whole house, front, back, and top as needed. Rebuilding your house may disrupt your garden or your cellar. Structures nearby are important, and your surgeon will ask you about your bladder, bowel, and sex life both before and after surgery. A good architect will rebuild your house with as little disruption to your everyday life as possible. In surgery, this is called minimally invasive. Research has shown that the more your surgeon can accomplish through the vagina, the easier it will be for you to recover once you get home after surgery. If you don't need to use the house anymore, your surgeon may recommend a procedure called colpoclesis, where the vagina is closed and never used again. This causes minimal disruption to nearby structures and has the fastest recovery with best success. If your house needs rebuilding, a good architect will want to rebuild a roof and reattach it to strong supportive beams. Your surgeon may recommend using sutures or sutures braided in a mesh material to form a strong sealing to the vagina. Typically, just sutures are used first. If sutures aren't enough and you return with prolapse later, a mesh implant could be added in a second surgery. If you have a strong preference to keep your uterus, you should discuss this with your surgeon. Keeping the uterus seems to make no difference to success in the short term, but it may affect how long your repair will last. On the other hand, just removing your uterus is not enough to fix your prolapse. This is like leaving an open roof to a house with weak walls. There are two ways to measure success of surgery for prolapse: how you feel after surgery and what your surgeon sees when examining your vagina. Ideally, both the owner of the house and the architect should be satisfied with the structure and its supports. Pelvic floor specialists, also known as urogynecologists, have researched success up to 5 years after these surgeries. It's hard to know how strong your pelvic floor repair will be after 5 years, but research is ongoing. Apical prolapse surgery is designed to improve your quality of life, and you always have a choice in what method the surgeon will use to fix your prolapse. You should understand all the available options before your operation. For prolapse treatment options that don't involve surgery, please check out our Kegel exercise resources and our pessary video here. So remember, surgery is the last resort, but it can help with structural support of your pelvis. There are many options to rebuild your vagina, and most will improve your bulge symptoms in the first 5 years after surgery. Talk to your urogynecologic surgeon about the best option for you.